Dear Professor Kotler, Mr. Parajuli, Mr. Abramowitz, MS Pinto, the Executive Director, Glenmark Pharmaceuticals, distinguished guests, ladies and gentlemen. I'm indeed very pleased to be with you and all the guests this evening. This crowning of such an engaging, non-hierarchical and multi-thematic conversation among professionals and kindred souls from 40 countries across 8 time zones. Let me start by offering my warm compliments and deep appreciation for Idobro and the Rise Infinity Foundation and all partners who make this brilliant human confluence possible. The COVID-19 pandemic has severely slackened the pace of implementation and achievement of SDGs across the world. It has also brutally demonstrated in one fell sweep how relentlessly integrated the world is and how intertwined different actors, stakeholders, and responders are. Thus, we have also seen an outstanding growth of partnerships among a very large number of diverse agencies and stakeholders. So, a multi-layered world summit like this, seeking breakthrough interactions, has actually been planted on a very fertile ground. India's coordinated fight against COVID-19 has been the most important package of measures to shield the progress made on SDGs from the impact of the pandemic. Our systematic pandemic management plan has included system-wide measures and initiatives focused on specific groups as well as identified multi-sector interventions to contain the pandemic and trigger a sustainable recovery. 6 high-level empowered groups headed by top policymakers have led critical aspects of COVID-19 management, from health infrastructure, personnel and services, essential medical equipment and human resources, economic and welfare measures, data supply and logistics management, awareness and information support, data management coordination with the private sector, civil society and international organizations. Without going into a lot of details, I would like to highlight some major intervention. Firstly, emergency fiscal support was extended of close to $23 billion, which ensured immediate financial assistance, food security, and additional pensions for senior citizens. Special support was extended to migrant workers and frontline health workers who were exceptionally impacted by the pandemic. Health and accident insurance was provided to healthcare workers. Comprehensive interventions have also been rolled out for women and children. During the lockdown, about 85 million women and children beneficiaries were supplied food ration directly at the doorsteps. In the same period, nearly 500,000 more women were given maternity benefits. Ladies and gentlemen, Anganwadi workers who look after children at the grassroots levels have been provided increased insurance coverage to strengthen outreach and delivery of nutrition provisions. As work, employment and enterprise suffered widespread disruption, the government initiated the Atmanirbhar Bharat Abhiyan, a self-reliant India program to provide fiscal stimulus to ensure access to health and nutrition, necessary capital support, easing of tax compliance in order to strengthen livelihoods. A huge package of measures have been initiated in various economic sectors to stem decline and build back better. Some of them are support for infrastructure development in animal husbandry and direct benefit transfer to 87 million farmers in agriculture, infrastructure development and direct support to beneficiaries in the fisheries sector. Support and services outreach was vastly expanded by multiplying partnerships that involved as many as 92,000 civil society organizations, all major industry networks such as in India and their constituents, the UN and other international organizations. For example, renewed synergy between the government and the private sector has resulted in India not merely producing PPPs but exporting PPPs from India. Every day, we have been a major exporter across the world, whereas at the beginning of the pandemic, we were producing no PPPs, no ventilators, no masks. And therefore, this has helped optimize the safety and inclusion quotient of the pandemic response. As I have already said, providing for food and nutrition security has been a top priority and an abiding intervention area since a large number of people have experienced loss of work and income. This has been possible by dint of the pervasive food security system that has been built up across the country and other initiatives that rode on it. A far-reaching transformative solution being implemented as a response to the pandemic is the One Nation, One Ration Card initiative, which ensures right-based access to food supplies and covers over 800 million people at costs of low as 3 to 5 US cents. It has also been noted that combined effects of malnutrition, the pandemic, and natural disasters like cyclone have increased the threats for vulnerable people. The disruption of supplies and services has added to the load of malnutrition while aggravating the economic slowdown. Emphasis is now being laid on nutritional self-reliance, activation of nutritional surveillance, reduction of delays in delivery of nutrition and other services such as treatment for mental health issues. At every stage of the COVID-19 response, we have seen what invaluable service has been rendered by our frontline workers, doctors, nurses, and health and nutrition workers. Our hearts ever fill up with gratitude and concern for them. While a number of measures have been taken to support and protect them and aid them in their work, they deserve more. Therefore, I feel especially gratified to have the opportunity to hand out the Glenmark Nutrition Awards this evening. Each one of them is a crucial source of inspiration and hope in our response to the pandemic and other problems that conspire with it. As I conclude, I cannot but wonder how many bridges were built and how many new initiatives fertilized over the last 2 days. I would like to offer my best wishes to all the ideators, innovators, and aspirant entrepreneurs who have made this summit a success. The Akshapatra Foundation, Tata Trust, Piramal Foundation, Piramal Swast, Bill and Melinda Gates Foundation, and many other organizations have done a creditable and immense job in providing support at the ground level during the pandemic. I am glad to note that Glenmark Foundation was among the first to come forward to support the most vulnerable, be it those in need or those at the front line through initiatives such as pledging 5 million meals and providing essentials to migrants. It is also heartening that Glenmark Foundation has focused on malnutrition from the outset, and these nutrition awards are another attempt to strengthen the non-profit sector for fighting the scourge of hunger. In conclusion, I would like to commend the efforts of all the COVID-19 food warriors who have played a crucial role in ensuring food and nutrition security during the time of crisis. Thank you very much, ladies and gentlemen.